everybody. My name is Jorge Machuca. Today I'll be discussing ethical issues and implications in research surrounding community, specifically within the allied healthcare field. As healthcare professionals, we not only provide clinical care, but we also provide research that advances patient outcomes. Understanding how to communicate ethically helps us maintain three key things: trust, integrity, and respect for human dignity. Before diving into the ethical side, first I want to take a look at what defines effective scientific communication. I believe there are key principles in scientific communication. It's built on 5 key principles, in my opinion: accuracy, clarity, transparency, integrity, and respect. Accuracy is presenting data truthfully without exaggeration. Clarity, ensuring findings are understandable and meaningful. I believe transparency is being open about conflicts of interest, funding, and limitations. Integrity is reporting results honestly, even when they don't support our hypothesis. Respect is valuing every participant, colleague, or collaborator. I think that together these principles form the foundation of responsible and trustworthy scientific work. Now that we've kind of covered the communication principles, I'm going to go into ethical implications in human research. I believe when conducting research involving people, allied health professionals must protect their rights and well-being. I think key ethical principles include autonomy, beneficence, non-maleficence, and justice. Autonomy means participants must have the right to make informed decisions. Beneficence and non-maleficence requires us to maximize benefits and minimize harm. Justice demands fairness in subject selection and treatment. I believe that failing to communicate honestly or obtain informed consent can cause harm and undermine trust as well. For allied health professionals, maintaining confidentiality and ethical communication it's very essential. I think, ethics don't end once the study is complete. I believe it's how we communicate and share results is also very important. Now, going into ethical issues, common ethical issues include data manipulation, plagiarism, authorship disputes, and selective reporting. For example, exaggerating positive findings or omitting negative data misleads both professionals and public. I believe poor communication between research teams can also lead to errors or misuse of findings. As health professionals, we have a duty, and it's to communicate honestly, give proper credit, and share information transparently. So I believe doing so strengthens public confidence and healthcare research as well. Now, next, let's connect these ethical ideas to our everyday communication ethical practices. So, for instance, ethical communication extends to how we interact with patients, families, and healthcare teams. With patients and families, I would use clear, compassionate language, avoid jargon, and check for understanding through questions and active listening. With other professionals, I would communicate respectfully, stay conscious and evidence-based, and remain within my scope of practice. Never really want to go outside of it if it's not anything I'm not knowledge of. These approaches, I believe, they build trust, they reduce errors, and they support collaborative, patient-centered care. Now, beyond speaking, written communication also reflects our professionalism and ethics. Whether writing reports, emails, or research papers, I believe clear professional writing is very key. I would maintain a respectful tone, ensure accuracy, and cite information properly. I believe that a strong written communication promotes transparency, respect, and credibility for both individual and organization. And yeah, in closing all this, ethical communication is essential in both research and practice. I believe by communicating to honesty, respect, and professionalism, we protect the dignity of those we serve and strengthen the integrity of our professionals. Thank you for listening.